Okay, let's jump right in. The 36th edition of the CLSI M100 is here, and it brings some pretty big changes that labs need to get ready for by 2025. We're going to walk through exactly what you need to know.
So, we've organized everything into 5 main topics. We'll kick things off with the big structural revisions, then get into the nitty-gritty of breakpoint changes for specific organisms. After that, we'll cover what's new with direct blood culture testing and QC, and we'll wrap it all up with a summary of the most critical changes you need to act on.
All right, let's start with the big picture, the major structural revisions. We're talking about how the document itself has been reorganized and what content has moved around. Okay, so there are some pretty notable shifts here. For starters, Salmonella and Shigella have been pulled out and given their own dedicated table. That should make finding that info way easier. A really big one is for Burkholderia cepacia. All of its epidemiological cutoff values, the ECVs, have been completely removed. Gone. You also find Appendix D, which covers anaerobes, has gotten a major overhaul with a bunch of new data. And, of course, new agents like contezolid are now showing up in the glossaries.
Okay, so now that we've seen how the document is structured, let's dive into what that means for the actual breakpoints for some key organisms.
First on our list is Enterobacterales. The big news here is all about a new combination agent being added to the mix.
So the new agent is aztreonam-avibactam. It's been added as a Tier 3 agent, and with it come new disc diffusion and MIC breakpoints. You'll find those in Table 2A1. But what's really important here is the new comment about confirmationary testing. This is to help you and your lab avoid those tricky false intermediate results, so definitely pay attention to that.
All right, next up is Acinetobacter species. And wow, there are some pretty significant revisions here, particularly for the aminoglycoside breakpoints. So as you can see, the breakpoints for amikacin, gentamicin, and tobramycin have all been updated. This applies to both disc diffusion and MIC testing. And just a heads up, the reporting recommendation for sulbactam-durlobactam has been relocated, so you'll want to double-check where that falls in the testing tiers now.
Now for Neisseria gonorrhoeae. The changes here are frankly critical. They're focused on cephalosporins, and you're going to see some important things have been removed and modified, which will definitely impact how you test for it. Okay, this is a big deal. For both cefixime and ceftriaxone, the disc diffusion breakpoints have been temporarily removed. Let me say that again. You can't use disc diffusion for them for now. This is a major shift. The thinking is that labs need to move toward MIC-based methods, and to support that, the MIC breakpoints themselves have been updated. They've revised the susceptible category and added intermediate and resistant categories, giving you much more detailed information for treatment.
Okay, moving on from those big 3, there are a few other organism updates in this new edition that you'll want to have on your radar. So for Stenotrophomonas multifila, you'll see a revised disc diffusion breakpoint for cefiderocol. And for the beta-hemolytic strip species, they've now added MIC breakpoints for trimethoprim sulfamethoxazole, along with Tier 4 testing and reporting recommendations.
All right, let's switch gears a bit and talk about direct blood culture testing. These updates are all about getting those rapid, actionable results directly from positive blood specimens.
So a few key things to note here. For Enterobacterales, they've added piperacillin-tazobactam disc diffusion breakpoints, which is a great new tool for rapid testing. But for Acinetobacter, they've done the opposite. The tobramycin disc breakpoints have been temporarily pulled, so you'll need to adjust your rapid panels for that. And for Pseudomonas aeruginosa, there's a new rule. If you get an intermediate result for cefepimine, you now have to perform confirmatory testing. It's an extra step, but it's all about improving accuracy.
Okay, on to quality control, or QC. As you know, these QC modifications are absolutely essential for making sure your testing is accurate and reliable every single day.
We're seeing a bunch of new QC ranges being added, especially for some of the newer agents. For example, you can see contezolid has new ranges for S. aureus, E. faecalis, and S. pneumoniae. And another new agent, zosurabalpin, now has QC ranges for A. baumannii.
It's not just about new agents, though. They've also revised some existing QC ranges. The imipemim MIC range for a couple of specific K. pneumonia strains has been updated. Same goes for the spectinomycin disc range for N. gonorrhoeae. And finally, they've added QC ranges for 2 new combination drugs, aztreonam-avibactam and cefixime-nacubactam.
All right, let's wrap this all up. We're going to summarize the most critical, high-impact changes from the 36th edition. Think of this as your immediate action list for the lab.
Okay, here are the top 5 things you need to address right away. 1.
For N-gonorrhea, you have to stop using cephalosporin disc diffusion and switch to MIC-based methods. 2. For Acinetobacter, implement those revised breakpoints for amikacin, gentamicin, and tobramycin. 3. For Enterobacterales, get the new aztreonam-avibactam breakpoints into your system. 4. Update your direct blood culture panels, add pip-tazo for Enterobacterales, and remove tobramycin for Acinetobacter. And 5. For B-Sapatcha complex, you have to completely stop using and reporting all of the old epidemiological cutoff values. That's a hard stop.
So with all of that in mind, the big question is, what's your plan? How is your lab going to update its protocols and its antibiogram data to reflect all these new M100 revisions? It's definitely time to start putting those plans into action to stay current with the national standards.